7 simple diabetic foot pain relief tips. If you are a person with diabetes, you've probably heard about peripheral neuropathy, which is a frequent contributor to diabetic nerve pain. In this video, I will discuss some remedies and therapeutic solutions to relieve diabetic foot pain. Foot pain is common among people with diabetes because chronically high blood sugar damages the nerves. That type of nerve damage is referred to as diabetic neuropathy and most often affects the extremities. While some might experience tingling or numbness in their legs and feet, for others, it could involve mild to debilitating pain. If you suffer from foot pain because of your diabetes, your doctor might prescribe some medication. But there are other things you can do to help relieve your pain in addition to medicine. Try these 7 simple diabetic foot pain relief tips and see which works best for you. 1. Apply capsaicin. In 1991, the Archives of Internal Medicine published a study on the effects of topical capsaicin cream on diabetic neuropathy pain relief. The study involved treating patients with either capsaicin cream or simple vehicle cream. Researchers found that the capsaicin cream led to significantly more favorable results in terms of pain relief, which led to an improvement in patients' quality of life. 2. Soak your feet. Soaking your feet in warm water is an excellent way to boost circulation and get instant pain improvement. You can also add Epsom salts to your foot soak to absorb some magnesium into your body. But because your diabetic neuropathy might not allow you to judge water temperature correctly, use a thermometer to avoid hurting yourself in scalding water. Your foot soak should be no hotter than 100 degrees Fahrenheit, approximately 38 degrees Celsius, and you should soak for no longer than 15 minutes. Once you're done, use a clean towel to dry your feet off completely. 3. Take magnesium supplements. Magnesium research published one of the most compelling studies on the effects of magnesium supplementation on diabetic neuropathy in 2004. Through a clinical trial, researchers found that long-term magnesium supplementation slows down the progression of polyneuropathy in type 1 diabetes patients. Additionally, magnesium has long been used in pain management and should help relieve the discomfort associated with diabetes. 4. Take ALA supplements. Alpha-lipoic acid is a potent antioxidant that helps reduce cellular damage. In 2009, the Review of Diabetic Studies published a review that showed the positive effects of ALA in reducing oxidative stress and, consequently, minimizing the risk of nerve damage in diabetes patients. The researchers found that supplementation of 600 milligrams alpha-lipoic acid helps reduce pain, numbness, or prickly sensations typically associated with nerve damage. 5. Try evening primrose and vitamin E. According to a study published by the Indian Journal of Endocrinology and Metabolism, supplementing with a combination of evening primrose and vitamin E has positive effects on mild to moderate neuropathy caused by diabetes. In the study, the beneficial results were achieved by taking 400 milligrams of vitamin E, along with 500 to 1,000 milligrams of evening primrose per day. 6. Promote blood flow. Good blood flow is essential to preserving the remaining nerve function in your feet and will also help reduce the painful symptoms of neuropathy. You can improve blood flow by massaging your feet with your fingers or by rolling a tennis ball using your soles. Just make sure you're careful not to overdo it or damage the skin, as this can worsen your condition. 7. Get enough sun. Sun exposure might not seem related to diabetes, but a study published by Diabetic magazine in 2018 suggests a significant connection. In the study, participants with more painful diabetic neuropathy had lower levels of vitamin D in their bodies. Since the body naturally produces vitamin D when exposed to sunlight, your nerve pain might improve from regular sun exposure. These 7 simple diabetic foot pain relief tips are meant to ease the nerve-related discomforts commonly associated with diabetes. Although these methods are proven effective in helping alleviate nerve pain from diabetes, you must work with your doctor to find the best and safest ways to manage your condition. Following our study references we use to create this video, so you can do your own research. Thank you for watching. If you liked the video, please share with your friends, and please subscribe to our channel if you haven't already done so. If you want to be notified of our new uploads, do the following. New subscribers, click on the bell icon when you subscribe. Old subscribers, please turn on all your notifications.